everyone, it's your host Davia, and we're breaking down medication and psychiatric care in addiction recovery. And joining me to share why these treatments can play an important role in helping people heal is Dr. Corey Richardson, the CEO and Clinical Director of ICGH. There is a stigma around medications like Suboxone, right?
Exactly.
And I know this medication is commonly used for people that have opioid use disorders.
That's correct.
So why are medications such an important part of addiction treatment?
Well, there are a couple different reasons, and I'm glad you addressed the stigma, because that's the biggest part with addiction treatment, mental health treatment, and it's unfortunate because these are medical conditions just like diabetes, just like a lot of other ones. But a lot of medications like Suboxone are merely blockers. They block the receptor site so that the drugs can't get in there, and it takes care of the craving and withdrawal so that people can focus, they're not sick, and they can engage really fully in treatment. But these have been life-saving and been a big part of reducing the overdose death rates across the country.
And so how do medications and psychiatric care work together in recovery?
Addiction has a lot of multifaceted kind of factors, if you will. So you need different interventions, and a lot of people that are coming to us don't just have a genetic predisposition for addiction, they sometimes come from trauma. So child trauma, complex trauma, even sexual abuse. And it's kind of like if you don't treat the whole person, you're not going to get the right treatment outcomes. And so with medications like Suboxone to help with addiction, and psychiatric medications to help with trauma, and that's not all we provide. Talk therapy, which is like counseling, peer support specialists, people with lived experience, recovery housing, so that people can have a safe environment without drug use, supportive employment so they can learn workplace skills, GED and literacy, even our mobile units to get out to people who are in remote and rural areas. It takes a real robust program to really affect the impact we need in our communities.
And so what would you say to people who believe medication isn't real recovery?
I'm a person in long-term recovery. I'm about to celebrate 28 years. And so there are a lot of things back in the day that weren't available. People aren't getting high off Suboxone. They're not getting high off Vivitrol. They're using these as part of their recovery, just like going to meetings, calling sponsors. It's a part of the treatment plan to help you sustain your recovery. And so the kind of the old dose and go model where people are just getting medication and that's it, and they're not trying to abstain from other drugs, they're not trying to improve the other aspects of their life. That's not what we're trying to talk about here. We're talking about a full, robust program for treatment planning and long-term recovery.
And so how accessible is medication-assisted treatment for individuals in the program?
Absolutely accessible. You don't have to be immediately available to one of our regular clinics. We'll work with you where you are. And with Medicaid expansion across North Carolina, just regular Medicaid insurance is more accessible, where we'll help you enroll in Medicaid.
So how is ICGH expanding access to these evidence-based treatments in Eastern North Carolina?
We've opened our Carolina Wellness Inpatient facility. So if you are struggling with addiction and you need detox, crisis management, and then residential care, we can help you. Through our recovery housing, so after inpatient care, you can go right into recovery housing if you're unsheltered or unhoused, or you're in an environment that's not safe or conducive to recovery, we can work with you. Offering telehealth and medication-assisted treatment where you are is another way that we make it much more accessible. And so across the board, we've been lowering all the barriers and making higher levels of care available to people with or without insurance.
Well, Dr. Richardson, this has been very informative. Thank you so much for sharing. It's wonderful what you are doing for people in the community.